But we begin tonight with the latest on the coronavirus outbreak.
Yeah, let's take a look at the latest numbers right now. Here's a look at the trend. How many cases are being reported daily? Indiana's first case was reported back on March 6th. Compare that with the last 2 days. 75 reported Sunday and 58 more today. Now, this graph shows you the total number of cases. It's up to 259. Of course, testing more available now. There have been 7 total deaths, and you can see here in Indiana a dramatic rise in the number of total cases beginning about a week ago when more tests became available. State health leaders expect the numbers to climb as more people are tested. Now, across the country, there have been more than 41,000 cases reported, and at least 501 people have died.
Beginning tomorrow at midnight, Hoosiers will be required to stay at home.
Yeah, Governor Holcomb issued that order today, which does allow for some essential travel. News 8's Richard Essex starts our team coverage.
The executive order, bottom line, the governor wants you to stay home for the next 2 weeks. Grocery stores, gas stations, pharmacies, and other essential services will remain open. With a series of executive orders issued today, Governor Holcomb has ordered Hoosiers to stay at home. He says the next 2 weeks are critical to slowing down and stopping the spread of COVID-19. The state is asking you to travel only when absolutely necessary, work from home if possible, and avoid crowds. The state will keep prisons, Child Protective Services, state hospitals, and the National Guard operational. Welfare and unemployment applications will be conducted remotely. Governor Holcomb has given a grace period of 60 days for any state-issued license that is set to expire, including driver's license and license plates. The state is preparing for a surge of COVID-19 patients at area hospitals and has activated a healthcare emergency operations center to open supply chains for critical products.
It's because we're all seeing the same trends or waves coming, especially in the dense areas, but it is spreading to all counties. So stay home. Get groceries only when you need them and only buy what you need. I'm telling you, the next 2 weeks are critical.
The stay-at-home order does allow you to get outside, work at the yard, take your dog for a walk. Public parks will remain open, but playgrounds should be closed. For the next 2 weeks, the governor wants to make sure that everyone in the state of Indiana is outside of their house only for essential business or for essential services. In downtown Indianapolis, Richard Essex, Wish TV, News 8.
Richard, thank you. With Hoosiers ordered to stay home for at least the next 2 weeks, many are left with questions about what happens next. News 8's Aaliyah Hodges has more.
Downtown Indianapolis and other parts across the city will continue to look like a ghost town as Governor Holcomb says the next 2 weeks will be a crucial time in helping slow down the virus. From restaurants to schools, many places have already closed down. The stay-at-home order is taking effect when some people were hoping things can get back to normal.
I don't like it, but I'll get prepared for it the best I can, try and get through it the best I can. That's all I can do.
It starts Wednesday morning until April 7th. Some visitors News 8 spoke with say they want to travel back home before it begins.
My flight keeps getting canceled. I have a child to get home to, so I want to be able to go home tomorrow.
Some people who have been very cautious agree with the decision.
The governor, he thinks ahead, good precautions, worried about the citizens, worried about the people.
Mayor Hogsett and the Marion County Public Health Department are also pushing this order. People are only allowed to travel for mandatory work and meet essential needs. Food carryout is still allowed at bars and restaurants, including alcohol. A few businesses tell News 8 the governor's decision is a plus and it will help increase sales. One DoorDash driver says she's looking forward to the rise in deliveries.
They're protecting all of us. They mailed us our hand sanitizers. We could also get gloves. They have no contact delivery where we're allowed to sit the person's food on the porch and they can come out and get it so we don't have any contact with them.
The stay-at-home order is forcing people to social distance themselves from others, something everyone will have to do for some time.
We're learning from all this. We're not used to social distance. One way or another. We like to gather, have parties and, clubbing and stuff like that.
For a list of questions and answers related to the stay-at-home order, visit our website, wishtv.com. Reporting in downtown, I'm Aaliyah Hodges, News 8.
Aaliyah, thank you very much. As more and more coronavirus cases appear here in Indiana, hospitals now preparing to take on the pandemic at full force. News 8's Sarah Hignite spoke to those who are on the front lines, and she has the story.
We spoke to nurses who work in the top hospitals in Indianapolis. Now, we protected their identity so that they could speak freely on how they're being asked to treat the virus and what it's like inside of hospitals during a global pandemic. One of the most frustrating parts of this process is that not everyone is respecting the CDC recommendations.
It's not something that I'd be risking my family for, going to work every day to come home and see you at TJ Maxx shopping. That's not fair. If I'm going to work and I'm following the rules, then you should too.
Nationally, a large concern for healthcare workers is the lack of personal protective equipment. Hospitals in Indianapolis are also seeing that shortage, and some nurses feel the requirements for what they need to be wearing changes based on availability.
They're given at the beginning of their shift one gown, their gloves, mask, eye shield, and everything like that, while they're changing gloves and washing thoroughly between patients. We don't know if this is a droplet. You could have particles on your gown. You're going out of one room, you're coming back into another one. Are you cross-contaminating?
With no clear end in sight and no relief, nurses worry that eventually they'll have to start working without the necessary protective equipment.
Well, we don't have the mask for this. We don't have the supplies for this. Just because of this virus, it's not fair. It's endangering everybody, not just these people who are sick. It's everybody.
Patients who come into the hospital wanting testing are putting themselves and their families at risk of contracting the virus and inundating hospital staff, taking away time from patients who need to be seen.
If you can breathe and you don't require medical intervention to breathe, please stay home.
Nurses don't feel they're held to the same standards when it comes to self-isolation that they ask of their patients.
Cough, sore throat, fever. They aren't giving nurses tests. They didn't test her, and she had to come back to work. She wasn't allowed to quarantine. We're, I think, looked at a little more closely. But if our patients were saying oh, you can manage this at home, it's fine, stay home. But you're telling me to come in when I have one or two of the symptoms as well.
As we learn more about the virus itself and the situation in Indiana continues to develop, these nurses say they feel prepared to take on the pandemic.
Within the hospital, we're using our resources really well. We have a game plan in place should we need to use it. And we have a command center already set up. If it's coming, then we're ready for it. We've brought in extra ventilators. We've brought in extra staff.
After the governor's latest orders asking everyone to stay home starting Thursday, hospital workers ask that you respect that. And if you think you might have the coronavirus, do not call 911 and do not come into a hospital unless you have been advised to do so by a medical professional, either via phone or FaceTime or video call interview. Reporting, I'm Sierra Hignite, Wish TV, News 8.
Thank you, Sierra. Drive-through coronavirus testing is finally available in Indianapolis at Lily's downtown campus, but it's not yet for the general public.
As News 8's David Williams found out, the testing is only for active Indiana healthcare workers.
This includes physicians, nurses, pharmacists, and other healthcare professionals, and they must have a doctor's order for the test. Why? Because healthcare workers like Yancy are on the front lines.
I feel like I'm healthy in general. I would probably be okay if I were positive, but I just don't want to expose older relatives, patients, other nurses.
Monday, News 8 saw this electronic sign at the entrance telling people in line to stay in the car with the windows up. Indiana's State Department of Health tells me ISDH is exploring all options for expanding testing, and any drive-through or mobile events have been run at the local level. Hancock County's Health Department office manager tells News 8 they don't have plans to open a drive-through COVID-19 test site, but Hancock Regional Hospital offers a COVID-19 clinic. Hamilton County's Health Department Administrator Barry McNulty tells me they are in a holding pattern, waiting on COVID-19 test kits and guidance from ISDH about opening drive-through test sites for Hoosiers. Johnson County's health director tells News 8 they need test kits and a lab, but are scouting for drive-through COVID-19 test locations as we speak. For now, Yancey's in a wait of her own.
I hope I'm negative for sure, but I would rather know.
These drive-through COVID-19 test results come back in 1 to 3 days via an online portal. People's doctors will also get the results.
A Lilly spokesperson tells me the company is looking at opening up testing to the public in the future, but there is no timetable on that. In Indianapolis, I'm David Williams, Wish TV, News 8.
David, thank you very much. Lilly plans to expand testing tomorrow to include first-line responders in the city of Indianapolis, such as public safety, fire and ambulance, public servants. Those people should expect further instructions by their managers.